Anyway, somebody was telling me a few weeks ago, a picture of me on the call.
Okay.
All right. Heavenly Father, we thank you for this day. We thank you for the blessings that you give each and every one of us. We thank you for the opportunity just to be here this morning and to be among friends and fellowship and just to gather and think about service to our community, Lord, and the things that you have charged us to do and the ways that we can continue to do that. We thank you for the blessings you give us and providing for us each day. Keep us safe. In Jesus' name. Amen. Face the flag.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
And four-way test of the things we think, say, and do first.
Is it the truth?
Three.
Better friendship.
And fourth.
Work today.
I had a moment of Brooks there for a minute. Should we go backwards? Let's go third. Just kidding. So hey, good morning, everybody. You're stuck with the C team this morning. Rhonda is out of town on birdie duty, so she was in New York City on Wednesday, and Brooks had a little family thing to take care of, so you're stuck with me. So we got lots of stuff going on this morning. We obviously have some speakers that are going to share with us in a few minutes, but we have a few other things to get to first. Let's start first with any guests in the room.
Go ahead, Bob. You do first, and I'll do second.
Okay, we do have guests that have been here. One was a speaker here before, but Thomas and Danielle Rutherford from Seniors Helping Seniors. Thank you for coming.
And then we also have Kevin Woods. Kevin, if you'll jump up and introduce yourself.
Hey guys, my name's Kevin Woods, longtime Murfreesboro resident. Well, you may have been my venue. I'm one of the owners out of Hot Springs, out of east of town. Perfect bill, you guys. Very thankful for y'all for the barbecue festival. So, first time here and glad to be here.
And you're looking to get involved in the community outside. Okay, good.
Any other guests? All right, let's move into announcements. Bill, this afternoon, you want to hit on what's going on this afternoon?
Yes, at 4 o'clock we've got one of the best afternoons you can have is the dedication for Pam's Home for the Habitat for Humanity. So we'd love to have a great representation. This is the lady that we built the walls for back in February. So if you can join me over there, that would be great. If you have any, if you need to know exactly where it's at, look at the connector if you would, please. All right, and that's at 4 o'clock.
All right. Other announcements that anybody want to share?
Yes.
Yes.
Also, there's a sheet going around for perfect attendance. There was an email that went out, so if you feel like that you've got perfect attendance for the Rotary year of 2025 and 2026, please put that on there. Remember that any activities that you were involved with counts as a makeup, and any meetings and things like that counts as a makeup also. So if you do that ASAP, that'd be great.
All right. And this 2 years, you're good? Yeah. Okay. Just making sure I was on the same page. All right. The other thing you've got in front of you, this kind of goes in line. Oh, Bob's got, Bill put the VIP magazine on his table.
Page 20.
Check that out. Yeah, be sure to take one of those. There's a write-up, obviously it's mentioned on the cover, which is great. There's a write-up about the event, and then we had one of our members actually provide that ad that's on the other page next to it that kind of highlights sponsors and things like that. So it's kind of a nice 2-page spread. So if you haven't seen that, it's fantastic. It looks great. So that's for sure a big thing. Golf-wise, is there anybody from the golf tournament that wants to mention anything?
I'm on the golf committee, so I'll just say, if you know anybody or you yourself want to be a sponsor, find myself or somebody else will help connect you. September 30th at Old Fort. Whole sponsor is the lowest amount, I believe it's $175, up to as much as they want to give, I think.
There you go.
So just contact us if you need some help asking for some money.
All right. Are you ready? All right. Anything else before we get to the last announcement? So also on your table, I put a list of the officers for the 2026-2027 club year. Next week, we will actually have our installation program where we hand everything over and all those kind of things. But first, one item, small item of business that's on the table is a list of those officers. So these are the officers that have been recommended and put forth by the board of the club. And you can see who's listed there. President Brooks Cristal, he's president-elect, treasurer Matt Corcoran, young professionals Crystal Ledbetter and Angela Ledbetter, secretary Daniel Ames, Rotary Foundation Judy Powell, membership Bill Taylor and Lori Williams, service chair Sandra Smith, public relations Jamie Corcoran, and then we're still looking for someone in the new generation role. So I just want to open that up. Technically, the way our bylaws read, that's the motion from the board, but we can accept a nomination from the club if there's someone else who is interested in one of these positions or someone else wants to nominate someone. So I'll ask now if there's any of that.
Treasurer for the following year.
Yes.
So when if somebody is interested in being the treasurer, we have 1 year, I can train you on the new program that we have. So if you have an interest, please let me know.
So next year, not this
Correct.
time. All right. Anybody else for this year? Any questions about this? All right. So it doesn't need a motion, but we will need to vote as a club to put these folks in place so that they can be technically installed next week. So all those in favor, please say aye.
Aye.
Any of those opposed? All right. So we're set on that. Anything else before we get into our program? All right. Okay. So our speaker this week, Marcella Bianco with the Alzheimer's Association. So y'all saw her write-up. I won't probably read all of it to you. She currently serves as the program director for the state of Tennessee with the Alzheimer's Association, where she brings to work awareness, education, and support to communities across the state. She's passionate about empowering volunteers and building strong relationships that create lasting community impact. And she also brought with her Luke, who helps with the walks, I believe is correct.
Yeah.
And so they're going to come. Alzheimer's is something that I think we were talking about it lightheartedly at our table this morning, because sometimes that's kind of what you have to do. If you dealt with anybody in your family that has it, my mom has it, you just that's what you do sometimes. But if it hasn't touched you already, it will, I promise, at some point in time. So it'll be interesting to see what you have to share. Let's help me welcome Bianca.
Good morning. Thank you for having us here this morning. I'm just going to come on a little bit later to talk about the walk that we have at RUCO. As most of you probably know, that the Rotary is a national team for the Alzheimer's Association walk. So we expect you all to be out there at the RUCO walk this year. So I am Marcella Bianco. I'm the program director, as you said, for the Alzheimer's Association in regards to education and dissemination throughout Central Tennessee, then over the state. You all have some amazing resources here with some really great community educators, support groups already in the community, which I thank you for. And you do have a stellar walk team, walk leadership, not only with them, but with others within the community. Just a little background on me. I've only been with the association since January, but I have over 20 years of public health that was in tobacco prevention and control. So worked everything from a political campaign to restore tobacco prevention funding in the state of Florida, worked at a local health department, then went to the state health department here in Tennessee as the tobacco prevention program director. My mom is 86. She doesn't have dementia, she has Parkinson's. She's also over a 20-year breast cancer survivor. So I have done a lot of volunteer work. At that time, it was with the American Cancer Society. So from walks to going to DC to advocacy to the whole 9 years. So thank you all for being here today. And what I'm excited to talk about is, yes, we can joke and sometimes we have to be lighthearted about where we are with this disease. Bless you. But the exciting thing is that where we are for prevention. So I'm not going to talk all about doom and gloom today. I'm actually going to talk about hope. We do have some evidence base around 10 healthy habits for your brain. And one of the things that I want to challenge all of you, yes, I'm here to speak to your association, but I would love also to come in and speak to your businesses and the place where you work, because that's the step where we're going towards is brain health at work. So I'm going to go ahead and get started. Feel free to ask questions throughout. I work best that way instead of just sit and get. Just to show and share that Rotary is a national sponsor of the American of the association in regards to our walks, and so I thank you for all of that. I'm going to show you some numbers, not specifically to your area or to the state, but nationally what Rotary has been able to do over the course of a few years and the money that they have raised. We're just going to talk a little bit about some statistics. This is just the 2026, our facts and figures, which can be found online. These are a little bit staggering and concerning. There's over 7 million Americans living with Alzheimer's or dementia currently, according to our 2026 data. 1 in 3 dies with Alzheimer's or another form of dementia. One of the really numbers that stagger to me are that there's over 13 million unpaid Americans, unpaid caregivers. So that's family, that's friends, that are taking care of a loved one, that's not the licensed clinician, that is the ones that are unpaid taking care of their loved ones, where we know that often unfortunately turns into maybe they lose their job, the stress that they have, what support do they need to be a caregiver. Also, I know there's some women in the room. We are most prone to get the disease as women, and we are the number one caregiver. Sorry, Ned, but it's just this is stats, and that's where it is. Although since I've been with the association, I have met so many men across the state of Tennessee that have truly cared for their wives, and some of those are some of the most heartwarming stories that I've heard. Even ones from last night at another event that I was at. So not to diminish that, it's just the facts and figures to where we are. And of course, the dollar amount. So right now in the United States, it's costing the United States over $400 billion for medical expenses and care in association with Alzheimer's. If we continue on the path that we are, we expect by 2050 it'll be over $1 trillion, which is really scary. We know that our vision is a world without Alzheimer's, and one of the things that I'm so passionate about, we're going to talk about some of the things that the association does, but it's the research. We are the #1 organization in the world that puts the most money towards research, and that's where we are. And our researchers are fantastic. I've only been here with the association for 5 months. They've already been down in our community from the national office speaking to caregivers and our volunteers. So it's one of these, I always hear like other associations or other organizations, nonprofits have that research side, but you never see the research side. We know it's being done. Our research actually comes into community and is able to talk about the research that they do with us. So let me just, I didn't know this until I came to the association. Alzheimer's, dementia, you often hear it's interchangeable, right? So Alzheimer's, dementia. The easiest way to put it is that dementia is the umbrella term to all cognitive decline. So Alzheimer's is a form of dementia. And then there's others, vascular, Lewy body, frontal total, Huntington's. There is a Parkinson's related dementia as well. So dementia is the umbrella. Alzheimer's is just the cognitive decline, right? So what are some of the 10 warning signs? What are the things to look at? Memory loss that just disrupts normal life. So when I first came to the association, I heard this analogy and it just really stuck with me. So how many of you have gone into a store and then you come out and where'd I park? A lot, right? Can't find where I park. And then you're like, okay, I know I came down this aisle, I went into this door, oh, I got my key fob, and you're going through and hoping it's your car that's going on, right? Not the others that you heard. You can find your way back. That's normal aging, that's fine, we have so much going on in our brains, there's no cause for concern. If you come out of the store and you cannot retrace your steps, that's when there's a cause for concern. If you can't know the process to, well, which door did I come in? Oh, I have the key fob. If you can't remember those steps, that's when there's a cause for concern for cognitive decline. If you don't remember how you got there. Challenges in planning or solving problems, difficulty completing familiar tasks. I know my father-in-law, he wasn't actually diagnosed with a form of dementia, but he was a great Italian cook and could make the best chicken parm. And his cognitive decline, he forgot to bread the chicken and the sauce was all messed up and it was something that he never even needed a recipe for. So that's part of the cognitive decline. Difficulty completing familiar tasks. You often hear of patients with Alzheimer's, they don't want to get dressed, they don't want to get bathed because they're just not thinking about it that way. Also confusion with time or place, not really knowing the time of day. Having trouble understanding visual images and spatial relationships. Maybe there's new problems with speaking in words or writing. So sometimes you'll often hear it's like, I know the word, I just can't say it. I've done that too, right? Because my mom will say that to me. She goes, I just can't think about it. I'm like, then what's my problem? Because I sometimes can't remember the word. But it's different in their brain. They see the word, they know the word, they can't say the word. So it's one of those differences. Misplacing things and losing things, if they put their shoes in the refrigerator, but don't remember putting their shoes in the refrigerator, or blaming others that you stole my shoes, no, you just put them in the wrong place and they can't figure that out. Decrease their poor judgment, again, retracing steps. Oftentimes too, we see this on early onset because unfortunately Alzheimer's or dementia still has a stigma to it. And we don't want to admit that we're not quite right in the head. I remember back that it was a crazy mind disease, right? So they start to withdraw from family activities or from friends. That's early onset, and that just continues to get worse as the disease progresses. And then, of course, changes in mood and personality. My stepfather also had the disease. Now, he's passed away over 10 years ago. So you hear how many years did he have the disease before then? 5 to 10. We didn't have the research that we have now, or the resources that we have now. But his mood and personality, whoo, that went crazy. Like he was using a blowtorch in the middle of the room. Inside. How about handing out candy with a shotgun? Yeah, that's great. So yeah, poor judgment, changes in mood and personality. He also ended up with sundowners, which you might have heard, is that at night they are confused on the day and night time. So my mom would catch him in the middle of the night. It was a second marriage. She would catch him in the middle of the night, trying to get up and get dressed to work and go to work, to pick up his son to go to work. We lived in a completely different state. He hadn't worked in years. So that's the form of sundowners. The exciting thing is that we do have some early detection. And the early detection, I'm going to read this again because I'm new. I'm not going to read it, just refer back to it. But early detection is so key. And this is why we have to break the stigma to Alzheimer's and dementia, because there are resources out there. There's 2 approved medications that can actually slow the disease and reduce the symptoms of the disease if it's caught early. If it's caught too late, you can't do that. That's why early detection is so important. So the 2 drugs are through the U.S. Food and Drug Administration. They temporarily ease symptoms like memory loss and confusion. That's great. And then they are anti-amyloid drugs that target the disease by removing beta amyloid from the brain. So we know that participants in the clinical trials have improved cognitive function. Ooh. And I forgot how about this. They have improved cognitive function, which is very exciting. And I pulled up the 2 names because I always get asked this, and I can never remember. I need to write it down. They are lecanemab and donanemab. That are actually approved drugs. Again, in early stages, that's why early stage is so important. And we all deserve to be healthy, right? We all deserve to have healthy brains. And the exciting thing to talk about is not just, it's at an age. We want to teach our kids. My son is 16. He wants to go to the gym, build up his muscles. He knows it's good for all of that, but it's good for your brain. Let's start making the connection. When you talk about these 10 healthy habits, you're going to go, this is nothing new. But let's see how we can manage that this is good for our brain. And why is that important? Because if it's good for our brain, that means we can start preventing Alzheimer's. So that's why we need to care about our brain, is so that we don't get Alzheimer's. One other thing to know, just because we age, dementia is not an aging factor. That is not, everyone who ages is going to get dementia. It's not. The norm is not to get dementia. So how can we prevent this? We have some non-modifiable things that we can't change. Age, genetics, family history, and then what we can change, certain health conditions, and then our health behaviors, which is what we're going to talk about. You have a card on your table for this. It's the 10 healthy habits of your brain. We're going to go into each of these in detail, but it's not rocket scientist, and it's nothing that we can't do, which is one of the things that I love about it. So first, basically go to the doctor. Manage your blood pressure. We have criteria for what your blood pressure should be, and then also manage your diabetes. So if you have diabetes, make sure you're going to the doctor. Make sure you're taking your medication regularly. My dad didn't have Alzheimer's or dementia. He ended up having cancer, but he also had diabetes. And he got to be, I'm going to eat this and I'll just up my sugar. Let's manage our diabetes a little bit better. But that all plays into the next two steps: physical activity and then eating right. If we do those two things, that's going to help manage our diabetes and our blood pressure. So get moving. It doesn't have to be, I'm going to go run a marathon, I need to be healthy, so I don't know. That's not it. Go for a walk. Even for the elderly, I tell my mom during commercial breaks, move your legs up and down. Just keep your body moving. Any type of physical activity. Dancing, swimming, all of that is great. And then eating right. The basic thing for me to say for this, there's certain diets. We talk about the Mediterranean diet, which is what we recommend. Limit your processed foods. Eat fresh greens, leafy vegetables, fruits, and high protein, less fat. It's not rocket science, it's just the basics. Just the basics is what we're talking about. Maintaining all of that will help you maintain a healthy weight. Now that's maintaining a healthy weight for you. There's no specific criteria. I know you can go and do your BMI and all that, but you work with your doctor to what's that healthy weight for you is what we mean by maintaining your healthy weight. And if you're managing your diabetes, you're checking your blood pressure, eating healthier, exercising, you will be able to manage your weight. This one is harder for me. It's sleeping well. So maintaining your sleep, make sure you're getting good quality sleep. Is also great rest for your brain. Again, she's shouting in the back. I feel your pain. I'm not calling you out. I was at an event last night because this is like our end of fiscal year, so we're at an event last night and I came in from Australia this morning, so I'm doing the I will be crashing later and I may take a little nap. But sleep well, and that is those 8 hours, that's all, again, to you. What does your body need? Which I think is very important. So here's the basic recommendation, but what does your body need for that sleeping well? Being tobacco free, so not using nicotine. I had over 20 years of tobacco prevention and control. That's another one of our healthy things for our brain, so we can stop damaging our brain cells. But we also know it's good for our lungs, it's good for our heart, so that helps to manage your blood pressure, your diabetes. Also protecting your head. So if you're out there doing any type of physical activity, wear your helmet if you're riding your bike. Also, I talk to my mom because she uses a walker. So she'll walk up with her walker to the refrigerator, and then she walks over here without her walker to the counter. That's not maintaining a healthy head, because if she falls, what do we always want to say? Did you hit your head? Don't hit your head. So even for that, and it's just in general, right? I have stairs in my house, watching where I go so I don't fall to hit my head. So those are other ways of protecting your head, not just doing something with physical activity. You don't expect to walk around wearing a helmet, but just being cognitive where you're stepping off the curb. How many people almost just being aware of your environment and what you're doing. We say stay in school or challenge your mind. You're all here today. You're learning something new, that's good for your brain. You're challenging your brain. Not only that, even if it's not a presentation, you're all here starting to talk to each other, being engaged with one another. That is also cognitive function and helping you to maintain your healthy brain. It could be reading. Maybe it is taking an online class, doing Sudoku or word puzzles, crossword. All of that helps us to manage and challenge your brain. So really just keep it going. I talk to my mom a lot about that. Just don't sit and watch TV. You know, do something active to keep your brain going. Even puzzles, because that challenges your brain to try to find that piece of puzzle that really matches. So keep your brain active. That is currently the 10 steps that we have now. We are continually to, and I'm going to go over how these became our recommendations. We are still going through other studies, including hearing, eyesight, environmental changes, and how does that play a role with our healthy brain. And you can learn more on our website, which is also at the table. So how did we come up with this? This was with the U.S. Pointer study, so it is evidence-based. We took participants who were at risk of cognitive decline. We took a cohort of people, and here are your 10 healthy habits. You have to follow the strict schedule and go through these 10 healthy habits for 2 years. That's how long the study was. This other group, the other cohort, had the same 10 healthy habits, but it wasn't on a strict schedule. They could implement it how they wanted. Great news for both cohorts. They had, at the end of the 2 years, they had improved cognitive function. That's awesome. The group that had a strict schedule, their brains were 2 years younger than when they started. They are calling this our mammogram moment. If you remember, I know all of you in the room are old enough to remember, as I am. Mammography was not required or suggested how many years ago, right, to prevent breast cancer. And women kept dying of breast cancer because there wasn't any prevention measurement. And then they figured out, oh, if we do self-breast checks and if we have mammography, we can early detect the disease and people don't have to die. My mom is a living legend of that. She's almost a 25-year breast cancer survivor. She's 86. They're calling us right now, we are at our mammography moment. Good prevention on the disease. Simple things. We have a biomarker testing as well that can be done to see if you have the gene for the disease. It's really exciting times that we're in to be able to talk about prevention. To put it a little bit simpler, through the U.S. Pointer study, physical activity, exercise. It can be walking down the street, start slow, go to the mailbox, and go to the next mailbox. Monitor your health, which means just go to the doctor regularly, make sure you're staying on top of it. Proper nutrition, again, less processed foods, more fruits, vegetables, the leafy green good stuff, and lean proteins. Not to say you can't have the other stuff too, but just limit the other stuff. The processed food in your diet should maintain to be those healthy greens and vegetables. And then cognitive exercise. Keep your brain going, keep your brain active. So there's, again, we know that there's several different factors for cognitive decline. Dementia disease is different in everyone. It shows up differently. There's still studies being shown. I don't have any family history of it, but I got it, what happened, or I have a lot of family history of it, am I going to get it? We don't know all the ins and outs of that yet because the disease is so unique. But we are starting to see that if we're all the same and if we can manage our healthy brain and really start changing from the kids, right? I mean, did I share anything new? Nothing weird that you haven't heard of, right? We talk to our kids about that. Eating healthy, staying physically active. We just need to make that correlation that it's good for your brain. Yes, it's good for your heart. It's also good for your brain. We just really need to change that mindset. No pun intended. So what do we have through the association? What ways can we help? This is also on the card there. One of the things, if you walk away with nothing besides, oh yeah, she talked to me about eating healthy again, just like my doctor does, is our helpline. Our helpline is 24/7, 365 days of the year, with a licensed clinician that answers the phone. This is so imperative to me. This is one of the best things that I think that we have to offer. It's also over 200 languages. If you can use it for, if you're a caregiver or you're taking care of a loved one and you can't get them out of bed to take a shower, what do? Call them up, they'll be able to help you. If you have a loved one that you're starting to see maybe some cognitive decline, or they're starting to forget things, I don't know what to do, call them, they can help. Maybe you need resources and you don't know where to go, where to turn to. Call them, it's a national directory, they'll get you local to. In your community, this is what you have. These are the doctors you can go to. These are the assisted living facilities or the memory care facilities that you can go to. Also, maybe you as a caregiver, you need respite care. Like, I need to be able to take some time for myself, but I want to make sure that my loved one is safe. Who can I call that they can come as, as a professional to watch my loved one while I go and do some mental health for my own self? Because as we talk about brain health, I'm also in the sandwich generation. So I have a 16-year-old and I have an 86-year-old mom. I work full time. What am I doing to take care of my mental health? What am I doing to take care of my brain? Caregiver stress and exhaustion is overwhelming here in the United States for this disease. And we need to really start to learn to take care of ourselves. That helpline can give you any type of those resources. And it's a license. I would talk to you, it's not a volunteer. I would empathize with you, but you really don't want to answer your call at 2 a.m. They're a licensed clinician and they'll be able to help you. Free education and support, we're here today. It's a free resource. We also have free resources online. This is just one presentation of many. You have several support groups here in Rutherford County. You have places that go ahead and do caregiver support series. So it's one class per month at different places. Even talking about financial well-being, when is it time to start looking at finances? The other thing that we have is our trial match. So you heard me talk about some of these resources and some of the research studies that we have. Maybe thinking in your head, oh, well, I might be interested in that. You can go into our trial match, which is online. You can go to alz.org and find all these resources. The trial match, you can plug in where you live and they'll let you know if there's anything in your area that you'd be able to sign up for this trial. Us as a partnership with Vanderbilt University, they're doing several different studies that you might be eligible for, so I know there are things that are here locally to you. Of course, we can't do all of that without raising money and fundraising for research. So we have, before I bring up Luke, just to talk about one other funding opportunity that we have, which is called Do What You Love and Alls. You guys were here last night. Was that here, Rico?
Yeah, yep.
So,
Dance Murphy's Row.
so they had an event. Do you want to just talk a little bit about what it was?
Yeah, so Abby last night kind of partnered with Dance Murphy's Row to kind of have a routine. They had probably 10 different dances with professionals and non-professionals as well. So it was kind of a fun mix of seeing both. But yeah, it was a great night of just going out to fundraise. They had a raffle, silent auction. Yeah.
So there's different things, and it used to be called The Longest Day, if you're familiar with it, and now they changed it to Do What You Love. I was at an event last night in Mount Juliet in Wilson County, and it was a Del Webb community where they did a luminary ceremony. And they raised about $15,000 last night just with people coming out, over 100 people that were there. So it's Do What You Love at any time of the year. We are here to support our walk too, but anything that you want to do, there's a pickleball tournaments that they do in Montron. You can have a girls' night, everyone gets $5 to get in, and the $5 would go towards the association. The other thing that we do is advocacy, so we can't do anything without policy change. A couple things to mention about our policy and our advocacy. Just in February, we took a group of volunteers, our advocacy team took a group of volunteers to Nashville at the Capitol. And what they advocated for was the biomarker testing to get approved through insurance. So while we have biomarker testing to be able to identify if you have the gene to eventually get the disease, it's not covered by insurance. What we were able to do, it passed through the House and the Senate, and the governor signed it into bill, is that it's now covered by Medicare. It's now covered by Medicare in order to be able to be tested. So you may be sitting and thinking to yourself, this just happened last night, you're like, well, can I go get tested? I would raise caution to that, because yes, while I can go get tested for it, the other side of insurance hasn't caught up. So it could be denoted as a pre-existing condition, so you may not get coverage from other insurance, and then also for employers as well. So if you're looking for a job or switching jobs, then you'd be like, oh, you have this pre-existing condition. So yes, while it's there, it's it's not only biomarker testing for Alzheimer's, we were at the Capitol with the American Cancer Society, because it also detects cancer, it's biomarkers for different drugs. To take that one step further, they went to, 3 weeks ago, they went to DC. Our advocacy team took volunteers, because right now it's going state by state. It shouldn't be state by state. We should all be able to have coverage for this if it's something that's available. Before I bring up Luke, which is coming up next, to talk about walk, you have at your desk, it's just a sign-in sheet. This just, I don't need your anything but first name, last name on this. And that just proves what I have to do to show, yes, I was here and did a presentation doing my job. First name, last name, I don't need email address or anything like that. You will not get a call from me unless you want me to. You will not get any solicitation from the association, just first name, last name, and then that'll help me.
All right, thank you guys so much, Ryan. Thank you, Marcella. As she's mentioned, we are moving into a really exciting time with early prevention, detection, and moving into that 10 healthy brain habits. So I'm glad my mom gave me first kind of slide we'll talk about is you guys are a national team. So part of that is, in the past 3 years, you guys have been fantastic with your support, and I know speaking with Jim there, you guys have been honoring Jerry there every year, walking for him, making the team. So really appreciate you guys coming out. Just kind of take a look back at your guys' national presence as Rotary. Obviously, has grown throughout the years. We started with you guys almost at that 1,300 participant mark, and now over 2,000 of you guys, and has moved up from 350,000 to almost 750,000. So cannot thank you guys enough. That's obviously a huge boost in just over 3 years there. So really incredible. And we'll kind of move on to this year's walk to see an opportunity for you guys. Oh, well, first we'll touch on our Promise Garden flowers. So Promise Garden flowers every year at our walk, if you guys have been, with them to walk, we're going to hand you a flower. Those flowers do mean different things here. As you can see, the orange is just supporting the world without dementia. You may not have a connection, you may not be taking care of someone, but you're just there to support. If you do find a lot of people wearing those flowers, we love to have you guys out there. Yellow is, of course, those for caregivers, but if you have a parent, family member that you're taking care of, then of course, you would give people that flower. But as I've been in this role, I've come to see that those with the yellow flower are often going through the hardest of times, taking care of their family members and those caregivers don't get some of the love that maybe they should be recognized for. It's a very tough job. Purple is, of course, using someone with Alzheimer's, and then blue are those who are living with Alzheimer's. So as you're walking around the track there at TSU this year, if you come out, you will see people wearing or holding these flowers. That just kind of gives you a little background of what they go through there. So as you're kind of mentioned, as Marcella kind of touched on there, for the first time we do have treatments that can change the course of Alzheimer's with dealing with those amyloid betas. So we are moving into a really exciting time. And as you mentioned, they were just up in Washington, D.C. lobbying to get that covered by Medicare. It's really tough push. So really excited to move on to maybe one day having all of us wearing that white flower, which I know wasn't up there, but white flower is a little flower, and that is only carried by 2 or 3 people, and that's the keyer flower. So we have that to provide the hope. So hopefully one day everybody can walk with those.
So I don't have the slide to register, but do you want to go on to the? There you go.
Okay. Perfect. So I'll just kind of walk you guys through quickly, looking up. I think that was honestly Tennessee. But if you guys just go on Google and look up Alzheimer's Association Tennessee walks. Then you're going to come here, alzheimers.org. Pretty simple. You can just walk through find your 2026 block, type in zip code. Of course, with this, it's going to be under Murfreesboro, but of course, it's Rutherford County block. We'll include Smyrna and McMurray. Really simple here. We just got the contract signed and everything for MTSU, so we're really happy to be back there. We're going to be there the 17th. So I know in the past you guys have had a team. If you guys want to be a part of the team on Rotary, that's of course we'd love to have you as a national team. If you have your own company and would like to participate in that way, of course we'd love to have your guys' team there. Of course, as Marcella mentioned, she's happy to come in and provide some of that educational support, some of those kind of healthy brain habits for you guys as employees there while we're at work. But yeah, and if you're looking maybe to sponsor as well, feel free to reach out to me. But really just appreciate you guys' support here in the past, and hope to see you guys out here for another year. But thank you guys for your time.
Thank you all. Questions? Anybody have questions? I know they'd be happy to answer.
I do have a question. How is Alzheimer's positively diagnosed? Affirmatively, it's not, is it?
There is testing now compared to where we were, and I can email with more details to the group, and they can send it out, because I'll talk to our researchers for a more research-based answer for you. But I can tell you, like, what my stepfather did, which was probably, 15, 20 years ago, was like, do you know what date it is? Do you know who the president is? And draw to a clock. Draw a clock. Which I joke now, because I'm like, kids these days, they don't draw clocks. Well, that has to be, my 16-year-old. But they have advanced where they can do testing for it. Yes. To narrow it down, and that's why we know that there's dementia, but now we know there's Alzheimer's, there's Lewy bodies, there's frontal tobal. So yes, they can get specific diagnose for the disease. Yes, we have advanced in that research.
Any other questions? Let's hear it one more time. Thank you guys so much for coming. Appreciate it. Like I said, if you don't know somebody's touched by this, you will at some point in time, because it's very prevalent in our society. About that. Fill out, write your name on the form to help and support them as well too. And then some of those resources they have, which are free. Thank you so much for doing those. Take those with you. Back here next week, we'll have our installation of our officers and all those kind of things. So we'll see everybody back here in the hot next Thursday. And we're adjourned.
Thank you.